video will provide you with important information regarding the board's adaptation of the CMS-1500 and its associated processes. Although the content of this training is intended for medical providers, all of this information is relevant to those who will be using the CMS-1500. Voluntary use of the CMS-1500 and the medical narrative is expected to begin after the first clearinghouse is approved as an XML submission partner. To start, we will provide an overview of this initiative. Next, we will provide a list of the forms that are to be replaced with the CMS-1500. Then, we'll use the current doctor's initial report, Form C4, to identify certain data locations within a CMS-1500. In addition to the CMS-1500, medical narratives will be required, and we will outline the details you need to include in your medical narratives. To wrap things up, we will discuss the form submission process and requirements, and direct you to resources available to assist you. In order to increase healthcare provider participation in the workers' compensation system and improve injured workers' access to timely, quality medical care, the Workers' Compensation Board has made a strategic decision to adopt the CMS-1500 form. Providers have indicated that the unique paperwork requirements currently in the workers' compensation system are time-consuming to complete. To reduce the administrative burden and increase provider participation, the board will consolidate and eliminate certain medical billing forms and convert to the CMS-1500 form. This is the universal claim form used by medical providers to bill the Centers for Medicare and Medicaid Services, CMS, as well as health insurers. Careful review and discussion with various stakeholders confirmed that the CMS-1500 is easy to use and provides all the necessary information when combined with a medical narrative. The board will replace the following forms with the CMS-1500: Doctor's Initial Report, Form C4 and EC4, Continuation to Carrier Employer Billing Section, Form C4.1, Doctor's Progress Report, Forms C4.2 and EC4.2, Ancillary Medical Report, Forms C4AMR and EC4AMR, Doctor's Narrative Report, Form EC4NAR, Occupational Physical Therapist Report, Forms OTPT4 and EOTPT4, Psychologist Report, Form PS4, Ophthalmologist Report, Form C5, Doctor's Report of Maximum Medical Improvement Permanent Impairment, Form C4.3, will not be changing. During the voluntary phase, the board is encouraging use of the new CMS-1500 and the medical narrative. However, the forms listed here will still be considered valid for billing submission. Let's go through the process of showing where the data from the doctor's initial report, Form C4, will be located on the CMS-1500 form. On the board's website, there are sample CMS-1500 forms available, which label the specific field names. We will be using the doctor's initial report, Form C4, as an example to show where the information will be placed within the CMS-1500. This procedure is similar for all other forms listed on the CMS-1500 webpage. Let's start in Section A, Item Number 1. You will see the Name field is labeled with Field 2. Transfer the name to Field 2 within the CMS-1500. Next, Field Number 2 is the Social Security number. As labeled, this will now transfer to Field 1A on the CMS-1500. Field Number 3 is the Home Phone number. Transfer this phone number to Field Number 5 on the CMS-1500. Continue following the form guide to transfer your data. On the doctor's initial report, Form C4, under Section A, you will see that field numbers 10 and 11 are labeled as Initial Narrative Report. Any fields labeled with Initial Narrative Report should be included on your attached medical narrative, if applicable, rather than transferred to the CMS 1500. Before we continue with the rest of the form, we need to provide additional instruction for Section 17 on the CMS 1500. Although Section 17 is not a specific field noted on the doctor's initial report, Form C4, it requires specific information on forms where it is noted. The information in Field 17, 17A, and 17B should include the following information, if applicable, in order to ensure the acceptance of the CMS 1500. Field 17 is where you input the name of referring provider or other source when billing for services rendered by an individual or entity and the service was performed under the supervision of an authorized physician, or referred by an authorized physician, or ordered by an authorized physician. In Field 17, 17A, and 17B, the name of the physician, their state license number, and NPI number will be required. Additional technical detail, including field requirements, can be found on the board's website in the CMS 1500 field matrix. Field 19 within the CMS 1500 also needs additional instruction. You will see on page 1 of the doctor's initial report, Form C4, under Section C, form fields WCB authorization number and WCB rating code need to be transferred to Field 19 on the CMS 1500. Field 19 on the CMS 1500 will require specific pieces of information in order to ensure the acceptance of the CMS 1500. Additional technical detail, including field requirements, can be found on the board's website in the CMS 1500 field matrix. Also refer to the NUCC Reference Instruction Manual, July 2018 version. Continue transferring the data to their necessary field boxes within the CMS 1500 to the next page. On page 2, you will follow the same procedure for placing the data as labeled on the CMS 1500. On page 3 of the doctor's initial report, Form C4, you will see most of the data will be placed in the medical narrative. Page 4 of the form also includes several fields to place in the medical narrative. It is important to know that work status and temporary impairment and causation need to be placed at the top of the initial narrative report. Once you have finished with page 4, all of your data has been entered on the CMS 1500 and the narrative report. On the CMS 1500 page on the board's website, you will find other form details. If you select the CMS 1500 Requirements link, you will find a list of other C4 forms and their corresponding CMS 1500 fields. We covered examples of fields within the doctor's initial report, Form C4, that need to be included in the medical narrative rather than the CMS 1500. Let's take a closer look at the initial narrative report and its requirements. This should remain the standard practice for narrative reports per your field of medicine. For example, ophthalmologists are asked specific questions based on their specialty. On the CMS 1500 webpage, the CMS 1500 Requirements link also contains the medical narrative requirements required for each type of narrative report. We are now going to walk through the initial narrative report requirements for a physician. When you submit a CMS 1500 in lieu of a C4 form, you must also submit a medical narrative. When submitting a narrative, it should be sent through a clearinghouse, who is an XML submission partner.
For a narrative report submitted by a physician, for example, details should include work status, temporary impairment, doctor's opinion or causation, history of injury or illness, objective findings, diagnosis or assessment, and a plan of care. The first 3 listed, work status, temporary impairment, and doctor's opinion or causation, should be provided at the beginning of most narrative reports.
It is also important to remember that when adding your demographic information at the top of your narrative report, to please include your rating number and authorization number. Example narrative reports are provided on the board's website. On the first portion of the narrative report, physicians should add the patient's work status by providing the following information. Has the patient missed work because of the injury or illness? If yes, provide the date the patient first missed work. Is the patient working? If yes, provide the date or dates the patient resumed limited work of any kind or resumed full work. If the patient is not working, can the patient return to usual work activities as indicated? Are there any work limitations? If so, explain and quantify, including the anticipated duration of the limitations. Next, physicians should add temporary impairment to their medical narrative. This information should include what the percentage, 0 to 100%, of temporary impairment is, and a description of the findings with an explanation of how the impairment percentage was determined. The last portion of information that should be included at the top of a physician's narrative report is the doctor's opinion. The doctor's opinion should include the following. Indicate if, in your opinion, the incident that the patient described was the competent medical cause of the injury or illness. Indicate if the patient's complaints are consistent with his or her history of the injury or illness. Indicate if the patient's history of the injury or illness is consistent with the objective findings, or if it is not applicable at this time. Next, we'll take a look at some of the other types of attachments required based on your type of work. In addition to the CMS-1500 and the medical narrative, these are the additional requirements based on areas of medical specialty. These do not reflect what is in the narrative that is also submitted. For example, the radiology medical bill should also contain a bill or invoice for service and a copy of the radiologic report. This chart is also available on the CMS-1500 webpage for you to reference. It is important to explain the distinction between a clearinghouse and an XML submission partner. Several clearinghouses are in the process of becoming board approved for XML submission. Once they are approved, we refer to them as XML submission partners. Healthcare providers should partner with an approved XML submission partner or ensure that their clearinghouse has a data sharing agreement with one. The XML submission process is how an approved XML submission partner will submit CMS-1500s to the board. Why are we working with clearinghouses to become board-approved XML submission partners? Because this process will allow providers to electronically submit medical bills and narratives to their clearinghouse in the same manner they do today, and for the board to electronically receive CMS-1500 data and forms in the required XML format. This will include the CMS-1500 and applicable narratives and attachments. The board is currently testing XML submissions with several clearinghouses. Some carriers may be asked to participate in a pilot with a clearinghouse looking to become an XML submission partner. The board's website has a list of current XML submission partners for you to view at any time. Navigate to the board's homepage and search List of XML Submission Partners. Providers may be contacted by XML submission partners to assist with testing. As we move forward with the CMS-1500 implementation, we expect to bring on additional clearinghouses to become XML submission partners and continue growing this list. If your clearinghouse is not on the list, ask them to participate. To learn more, navigate to the board's homepage and search CMS-1500, where you can find more information including an overview of the initiative, registration information, sample documents, and crosswalks from current forms. It is important for providers to know that an electronic signature holds the same weight as a paper signature when using electronic submission. An electronic submission still requires a signature every time. An electronic process or symbol may constitute for signature of a party when attached to or associated with an electronic record and has been executed or adopted by a person with the intent to sign the record. For more details, see the New York State Electronic Signatures and Records Act, ESRA, and the ESRA regulation implemented by the New York State Office for Technology, 9 NYCRR 540. Although the submission process may be changing, the timeframes for medical report filing and bill submission are not. Medical report filing will continue to be at least 48 hours following the first treatment with a patient, 15 days after the initial report is filed, and subsequent progress reports at intervals are not to exceed 90 days. Also, bills must continue to be submitted within 90 days from the last day of the month in which the service is rendered, or in which the claimant received final treatment in a continuous course of treatment. Once you send a bill and narrative report to an XML submission partner, they will have up to 7 business days to forward it to the payer and then to the board. If the bill is rejected either by the payer or the board, the XML submission partner must notify you. It is the provider's responsibility to make corrections to any rejected bills so that it can be resent to the payer and the board in a timely manner. During Phase 1 of this initiative, the bill may be resent by paper. Are you currently submitting the EC4 NAIR electronically to the board? If yes, you are already eligible to submit the CMS-1500 and medical narrative reports through your XML submission partner in a similar manner. If you are unsure if you are eligible, visit this web page on your screen. If your name is on this electronic eligibility list, you have already gone through the steps to become eligible. If your name is not on the electronic eligibility list, you must execute a treating healthcare provider agreement for XML submission. Complete the board's XML registration by visiting the board's homepage at wcb.ny.gov, selecting Healthcare Information, and then selecting XML Form Submission at the bottom of this page. After your information is submitted to the board's XML registration, you will receive an email with the agreement to be signed and returned. This email will provide detailed instructions on how you can submit the agreement. Thank you for viewing this presentation. For more information, visit the CMS-1500 webpage on the board's website. If you have any questions, please email CMS-1500 at wcb.ny.gov.